Hey friends, good to see you again. In this video, I am about to discuss the properties and importance of the heart sounds, surface marking of the valves and the auscultatory areas. If you haven't watched my previous videos on heart and cardiovascular system and cardiac cycle, please have a look. They may help in understanding the whole meaning of this video. Before we go to the video, please consider subscribing if you haven't yet. Everyone may know that our heart produces sounds. Lub-dub, 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 lub-dub. Yeah. Doctors use stethoscope to hear the sounds clearly. Sometimes they are happy with the sounds and sometimes they are not. Yeah, there are good and bad heart sounds. Yes, the good sounds are known as the normal ones and the bad ones are known as the abnormal ones. The abnormal heart sounds are produced by the various abnormalities in the cardiovascular system. In this video, we are going to consider the normal heart sounds. There are two normal heart sounds. They are the so-called lub and dub. These are produced during the closure of healthy heart valves. We should note here that only the closure of the valves produce a normal heart sound and not their openings. When the ventricular systole occurs, pressure in ventricles increases. When the intraventricular pressure overcomes the intraatrial pressure, the AV valves close. It produces the first heart sound, the lub. During late ventricular systole, aortic and pulmonary artery pressure exceed the intraventricular pressure. So, the semilunar valves are closed. It produces the second heart sound, the dub. All the valves, the mitral valve, tricuspid valve and two semilunar valves lie behind the sternum. They make a line with each other that is nearly vertical. The mitral valve is located at the level of fourth costal cartilage, and the tricuspid valve lies behind the middle of the lower sternum at the level of fourth and fifth intercostal spaces. Two semilunar valves lie behind the left border of the sternum. The pulmonary valve lies at the level of third costal cartilage, and the aortic valve lies at the level of third intercostal space. When the closure of valves occurs, the valves vibrate. In the case of closure of AV valves, the vibrations are well conducted by the ventricles than the atria, because the ventricles are filled with blood. Now, the cusps of valves behave as sound generators and ventricles act as a sound box of a musical instrument. The vibrations are transmitted to the walls of the ventricles. The right ventricular wall is nearest to the chest wall at fourth intercostal space in parasternal area. The sound caused by the mitral valve is best heard at the apex of the heart. It's at the level of the fifth intercostal space in mid-clavicular line. The vibration produced by closure of semilunar valves are carried well by the pulmonary artery and aorta than the ventricles, because the blood is completely filled in vessels than the ventricles. So, closure of aortic semilunar valve is heard at the second intercostal space of right parasternal area, and closure of pulmonary semilunar valve is heard in the second intercostal space in left parasternal area. Left ventricle is stronger than right, so the left heart finishes the contraction before the right. And systemic arterial tree is very stiff and it has less compliance. The pulmonary system is low pressure system and it has more compliance. So it keeps accepting blood for a long time. Due to these two reasons, aortic valves close earlier than the pulmonary valves. The splitting is more pronounced during inspiration. During inspiration, intrathoracic pressure falls. It sucks not only the air, also the blood towards the heart. So, the right heart is overfilled during inspiration normally. The vascular bed in lung also expands with the expansion of lung airspace. So, some amount of blood remains in the lungs. So, pulmonary blood return to left heart is slightly reduced. So, right heart takes longer time to eject the blood and left heart finishes the ejection earlier. It produces the splitting in second heart sound during inspiration. It produces the droop sound. So that finishes the today's topic. I hope you have got to understand the normal heart sounds. Please let me know any of your doubts, opinions and feedbacks in the comments. Please share this video with your friends. We'll meet you soon with another interesting topic. Until then, stay connected and see you soon. Make a nice day.